to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here is what I bring to you all from the world of medicine. Cancer cells and how they are protected with immune response. Cancer cells produce small amounts of their own form of collagen, creating a unique extracellular matrix that affects the tumor microbiome and protects against immune responses, according to a new study by researchers. This abnormal collagen structure is fundamentally different from normal collagen made in the human body, providing a highly specific target for therapeutic strategies. The study, published in Cancer Cell, builds upon previously published findings from the Chair of Cancer Biology to bring a new understanding of the unique roles of collagen made by fibroblasts and by cancer cells. In its normal form, collagen is a heterotrimer consisting of two alpha-1 chains and one alpha-2 chain, which assembles to form a triple helix structure as part of the extracellular matrix. However, when studying human pancreatic cancer cell lines, the researchers discovered the cells expressed only the alpha-1 gene, that is called 1-alpha-1, whereas fibroblasts expressed both genes. Further analysis revealed that cancer cells have silenced the alpha-2 gene, or called 1-alpha-2, through epigenetic hypermethylation, resulting in a cancer-specific collagen homotrimer made up of three alpha-1 chains. To investigate the real-world effects of this observation, the researchers created knockout mouse models of pancreatic cancer with COL1-alpha-1 deleted only in cancer cells. Loss of this cancer-specific homotrimer reduced cancer cell proliferation and reprogrammed the tumor microbiome. This led to lower immunosuppression, which was associated with increased T-cell infiltration and elimination of cancer cells. Additionally, these knockout mice responded more favorably to anti-PD-1 immunotherapy, suggesting that targeting this cancer-specific collagen could help boost the anti-tumor immune response. Researchers said that no other cell in the normal human body makes this unique collagen, so it offers tremendous potential for the development of highly specific therapies that may improve patient responses to treatment. On many levels, this is a fundamental discovery and a prime example of how basic science unravels important findings that could later benefit their patients. The trauma of getting diagnosed with eye disease. A research team interviewed patients across a range of ages who had been diagnosed with eye disease in England over the course of several decades and assessed the psychological impact of the way their diagnosis was communicated. Study has been published in BMJ journal. Interviewees had been diagnosed with a variety of conditions including diabetic retinopathy, macular degeneration, Stargardt disease, and retinitis pigmentosa, all of which can cause significant vision loss. The interviews showed four themes: the convoluted process of being diagnosed, the impact of clinicians' words, the search for information, and reflection on what could be improved. Researchers found that patients often vividly remembered the way they were told they had their condition and the manner of the medical professional that delivered the news. This impacted on how they saw their vision loss and themselves, as well as their interactions with other people. Some had waited months or years for diagnosis from initially being aware of a problem, creating a sense of frustration and anxiety. One younger patient said, "You're told something is wrong, you're going to have an appointment in 14 weeks to have this test done. You need to wait 5 or 6 months for the results." 5 or 6 months is a long time when you're waking up every day worried and you're not sleeping well, and it's affecting relationships with other people, potentially your job. Some patients felt the need to trawl the internet to find out more, coming across misinformation and scare stories online and increasing their anxiety about this condition. This is one of the first studies to examine how the communication of a diagnosis impacts psychologically on a patient in the long term, and we found that the words and demeanor of medical professionals affected a patient's ability to come to terms with their condition, the researchers concluded. How potassium-rich food helps to improve women's health. Women who ate bananas, avocados, and salmon could reduce the negative effects of salt in the diet, according to a study published in European Heart Journal, a journal of the European Society of Cardiology. The study found that potassium-rich diets were associated with lower blood pressure, particularly in women with high salt intake. The study included 24,963 participants, 11,267 men, and 13,696 women of the EPIC Norfolk study, which recruited 40 to 79-year-olds from general practices in Norfolk, UK, between 1993 and 1997. The average age was 59 years for men and 58 years for women. Participants completed a questionnaire on lifestyle habits, blood pressure was measured, and a urine sample was collected. Urinary sodium and potassium were used to estimate dietary intake. Participants were divided into tertiles according to sodium intake, that is low, medium, high, and potassium intake, that is low, medium, high again. A total of 13,596 participants were hospitalized or died due to cardiovascular disease. The researchers analyzed the association between potassium intake and cardiovascular events after adjusting for age, sex, body mass index, sodium intake, use of lipid-lowering drugs, smoking, alcohol intake, diabetes, and prior heart attack or stroke. In the overall cohort, people in the highest tertile of potassium intake had a 13% lower risk of cardiovascular events compared to those in the lowest tertile. When men and women were analyzed separately, the corresponding risk reductions were 7% and 11% respectively. The amount of salt in the diet did not influence the relationship between potassium and cardiovascular events in men or women. The results suggest that potassium helps preserve heart health, but that women benefit more than men. The relationship between potassium and cardiovascular events was the same regardless of salt intake, suggesting that potassium has other ways of protecting the heart on top of increasing sodium excretion, the researchers concluded. The breakthrough for type 1 diabetes treatment. A world-first study by Monash University in Melbourne, Australia has discovered a pathway to regeneration of insulin in pancreatic stem cells, a major breakthrough toward new therapies to treat type 1 and type 2 diabetes. Using the pancreas stem cells of a type 1 diabetic donor, researchers were able to effectively deactivate them to become insulin-expressing and functionally resemble beta-like cells through the use of a drug approved by the US FDA, but not currently licensed for diabetes treatment. The study by researchers led to a potential treatment option for insulin-dependent diabetes, which is diagnosed in 7 Australian children every day, resulting in a lifetime testing of blood glucose and daily insulin injections to replace the insulin no longer produced by a damaged pancreas. The findings are now published in the Nature journal, Signal Transduction and Targeted Therapy. The advances in the genetics of diabetes has brought a greater understanding, along with it a resurgence of interest in the development of potential therapies, the researchers said. Patients rely on daily insulin injections to replace what would have been produced by the pancreas. Currently, the only other effective therapy requires pancreatic islet transplantation, and while this has improved health outcomes for individuals with diabetes, transplantation relies on organ donors, so it has limited widespread use, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.